The horrifying scene is playing out in Khartoum, Sudan, where two young medical volunteers have been detained, humiliated, and accused of stealing an ambulance. Mohammed Ahmed and Mohammed Jamal were working to reopen a closed hospital when they were mistaken for something they were not. More than that, the incident is symptomatic of a larger trend, one that could have devastating consequences for Sudan's complex and deeply troubled healthcare system. The crisis began when the Hajj al-Safi hospital in Bari was forced to close amid heavy fighting between Sudanese army forces and the Rapid Support Forces (RSF). The two volunteers were part of a brave group of activists working to reopen the hospital, to no avail that is, until they were targeted and arrested by army intelligence officers. It took days for their families to hear any news, then the army issued a statement accusing the men of stealing an ambulance. On top of that, the men were further humiliated by their captors who shaved their heads in a show of power. The horror continued when Dr. Atiya Abdullah, spokesperson of the Sudan Doctors Syndicate, and a man who had already received death threats for his volunteers' work, spoke out about the issue. He asserted that, despite the army's accusations, the men had done nothing wrong. The matter has, unfortunately, become a recurring theme in Khartoum and the surrounding areas. With close to 80% of the capital's hospitals either inoperable or closed, local doctors have been forced to work with outside aid like the World Health Organization and the International Red Cross. Even then, they have been met with intimidation, threats, and violence. Among the few remaining doctors is Dr. Hiba Omer, the first president of the Sudanese Medical Union. She was forced to go into hiding and even had her family evacuated after receiving death threats to her phone. Sadly, the same people who attack Omer and her colleagues for trying to save lives cannot seem to bear the thought of a candle being lit in someone's honor. This is the stark reality of Khartoum and its healthcare system. A system that is close to crumbling, made worse by the unchecked violence taking place in the capital. And while the peace activists and civil forces are doing all they can to promote safe health practices and create a new dawn, they are met with constant opposition. It is a sight no one should have to bear, and something that needs to be addressed by both the power-exerting forces and the international community. Not for the sake of personal glory, but for the people of Sudan who deserve a better tomorrow.